Welcome to Have More Babies. Today, we're jumping into something really important, maybe one of the most stressful decisions parents face, the childhood vaccine schedule.
It really is.
Yeah, and it's tough out there. We know that. Social media, it's just full of fear, lots of confusion. It makes what should be pretty straightforward medical advice feel like, I don't know, an emotional minefield.
Okay, let's unpack this. We've looked at a whole bunch of sources, really focused on clearing things up and showing why, being properly informed is probably the best protection you can give your child.
That's absolutely right. Our mission today really is to cut through all that noise. It's not about telling you what to think, but giving you the tools, the solid science, so you can feel confident when you talk to your doctor. If we connect this to the bigger picture, it's about turning that understandable confusion into, well, knowledgeable protection for your family.
I like that phrase, knowledgeable protection. So before we get into the myths and fears, maybe let's start with the basics. How do vaccines actually, do what they do? Yeah, sure. It's actually pretty clever science. Vaccines basically introduce your immune system to a tiny, harmless piece of a germ, like its fingerprint, you could say. This lets your body learn to recognize and fight it off without you ever getting sick from the actual disease. Think of it like a training exercise for your internal defense team.
A training exercise.
Yeah.
Okay, so the body learns, it builds a memory, so if the real danger shows up later.
Exactly. It's ready. It knows the enemy and can react super fast. And the research we look at really highlights the benefits are, well, they're threefold. First, obviously protecting your own child from some really nasty illnesses. Measles, whooping cough, polio, things we don't want to see come back.
Right, the direct protection. And the other two benefits are more about the community.
Yes, exactly.
Yeah.
The second is protecting others. This is so crucial. We're talking about shielding the really vulnerable ones, tiny babies, older folks, kids with weakened immune systems, maybe from cancer treatments. Your choice helps keep them safe too. And the third is preventing big outbreaks. Simple as that. Communities with high vaccination rates, they just don't see these diseases spread like wildfire. It's like building a firewall.
That seems so clear when you lay it out, but we know fear often kicks in, and this is where it gets really interesting. Parents go online, they see these scary stories. What are the top myths our sources point to? The ones causing real harm?
Yeah, the documents are pretty clear on the most damaging ones. Number one, without a doubt, is the persistent idea that vaccines cause autism.
Right. And we know the science says no, absolutely not. But where did that specific fear even start? I think understanding the origin helps people see through it.
That's a really important point. It wasn't bad science. It was actually fraud. It came from one single, very small study years ago. The main researcher, it turned out, had major conflicts of interest he didn't disclose.
Conflicts like what?
Like planning to patent and sell his own separate vaccine. The study was eventually retracted, fully pulled by the journal, and he lost his medical license over it. And since then, huge studies, we're talking millions of kids across the globe, multiple independent groups, zero link found, none.
Wow. So a massive amount of distrust sparked by actual fraud, not data. Okay. What's the next big one that worries parents?
Myth number two is this feeling that the schedule, all the shots, is just too much, too soon.
Yeah.
That it'll somehow overload a little kid's immune system.
Yeah, you hear that phrase antigen overload. Can you put that into context for us? What's the reality?
Sure. The thing is, a child's immune system is, it's designed to handle antigens. It deals with thousands, literally thousands, every single day, just from breathing, playing, eating.
You mean from dirt and germs in the environment?
Exactly. A simple cold exposes them to hundreds of antigens. The total number of antigens in all the childhood vaccines combined. It's tiny, really tiny in comparison. Their immune systems barely notice it, frankly. The whole overload idea just doesn't match up with basic biology.
That really does put it in perspective. Okay, and the third myth, the sort of paradox of success.
Yeah, that's a good way to put it.
Yeah.
Myth 3. These diseases are so rare now, why bother vaccinating?
And the answer is?
The answer is they are rare because we vaccinate.
Yeah.
Seeing no polio isn't a sign the threat is gone forever. It's proof. The shield, the community shield, is working. If we let that shield down, those diseases are just a plane ride away. They can come back, and quickly.
Okay, that flows right into the schedule itself. Some parents, they get the importance, but they think, maybe I'll just space them out more, make my own schedule. Is delaying or modifying the schedule actually safer?
Well, here's the thing. When you delay, you're basically choosing to leave your child unprotected during specific windows of time. And often, these are the times they are most vulnerable, especially babies and toddlers. They're the ones who get hit hardest by complications from these diseases, hospitalizations, even death. The recommended schedule is timed precisely by experts to give protection right when they need it most, based on when they're most susceptible. Delaying the shot means delaying the protection.
But what about when the schedule itself gets updated? Experts change the recommendations. Doesn't that make parents worry the old way wasn't right, or maybe this new way isn't fully tested?
That's an understandable worry, but actually seeing the schedule get revised, that's a good sign. It shows the science is constantly learning and improving. It's progress, not a red flag. Experts update it because, well, maybe new data shows slightly different timing gives even better immunity. Or maybe there's a new vaccine available for a serious disease like rotavirus or HPV that wasn't around before.
Oh,
It just means they're refining it, making it safer and more effective based on the absolute latest global research.
got it. So let's widen the lens now from one child to the whole community. That's where this idea of herd immunity comes in, right? Explain that for us.
Yeah, herd immunity, or sometimes called community immunity. It's pretty simple,
Yeah.
really. When enough people in a community are vaccinated, a disease just can't spread easily. It hits dead ends. It can't find enough susceptible people to keep the chain reaction going. It basically builds a protective wall around the community.
And how high does that wall need to be? Like what percentage?
It varies a bit depending on how contagious the disease is. For
Hmm.
something super contagious like measles, you need really high levels, often upwards of 95% of people immune. When vaccination rates drop below that critical point because too many people opt out, that wall starts to crumble.
And that's when the vulnerable people get exposed.
Exactly. The tiny babies, too young for their shots, the kids with immune problems, maybe fighting cancer, they rely on that community wall. So a personal decision not to vaccinate suddenly has really big consequences for others.
And we are actually seeing this, right? Our sources confirm these aren't just theoretical risks from the past.
Oh, absolutely not theoretical. We've seen measles outbreaks pop up again in the U.S. in areas where vaccination rates slipped. Whooping cough causes outbreaks pretty much every year. Even polio, which we thought was almost gone globally, is still a threat where immunization is low, and we've sadly seen imported cases turn up even here recently. These vaccines protect against very real current dangers.
Okay, let's tackle one of the biggest emotional drivers, the fear of side effects. Parents worry about the shot itself, the immediate reaction, more than the disease they might never see. How should people realistically weigh that tiny vaccine risk against the potentially huge disease risk?
Yeah, that's a really common human thing, focusing on the immediate versus the potential future risk. It raises an important question about risk perception. Look, almost any medical treatment can have side effects. For vaccines, though, the vast majority are really mild, like a sore arm, maybe a bit of fussiness, or a low fever for a day. Serious side effects, like a severe allergic reaction, they are incredibly rare. We're talking like less than 1 in a million doses for many vaccines. Extremely rare.
Okay, so that's the vaccine risk, Tiny. What about the risk of actually getting the disease itself? Let's use measles again.
Right, let's compare. Measles. About 1 out of every 5 unvaccinated kids who get measles ends up hospitalized. 1 in 20 gets pneumonia, and about 1 in 1,000 develops encephalitis that's brain swelling, which can lead to permanent brain damage or death.
So a temporary sore arm versus pneumonia, brain damage, death.
Exactly. When you actually line up the real risks side by side, the danger from the disease is just astronomically higher than the risk from the vaccine designed to prevent it. The calculation is overwhelming.
So it's not that parents don't care, it's that they might be misjudging the scale of the risks involved.
I think that's often true. And the sources we looked at suggest something else too, that sometimes this avoidance of vaccines can unfortunately bleed into a general distrust of doctors and science, which isn't good for overall health decisions down the road either.
So if a parent is feeling unsure, maybe getting conflicting info online, what's the best way forward? Where can they find trustworthy information?
The best path to feeling confident really starts with good sources. Number one, absolutely talk to your pediatrician or family doctor. A good doctor expects questions, they should welcome them, and they can walk you through the data specific to your child. Second, look at reputable websites like the CDC, the American Academy of Pediatrics, public health organizations. They base their info on rigorous, reviewed science, not, scary anecdotes that go viral.
And if they want to understand the specific schedule we've been talking about, the timing and everything.
Yeah, understanding the why behind the timing is key. For really clear, reliable information on the recommended schedules and the science supporting them, a great resource is omegapediatrics.com. They break it down really well.
Okay, that's super helpful. So, wrapping this up, it feels like the bottom line here is that knowledge, solid, science based knowledge, is really the best shield you have for your kids and for your whole community. And seeing the schedule updated, that's a sign of better protection, not something to fear.
Absolutely. We covered a lot, from tiny immune cells right up to community health. Maybe here's one last thought to mull over. People sometimes talk about natural immunity from getting sick. And yeah, sometimes surviving an infection gives you long immunity, but it comes with a huge risk of actually suffering the disease, potentially with severe, life-altering complications or even death. Vaccine immunity gives you strong protection without having to gamble with those potentially devastating outcomes.
That's a powerful way to frame it. So, if you're navigating these important decisions, getting ready to talk with your doctor, or just want to dig deeper into the schedules and the science, definitely check out our resources. Please visit omegapediatrics.com for more details on childhood health and those immunization schedules.
And hey, if this conversation helped bring some clarity for you today, we'd really appreciate it if you'd like the video, subscribe to the channel, and maybe share this with another parent you know who's trying to sort through all this information.
Thank you so much for joining us.
Until next